Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about the portion of calendar year 2023 Medicare Final Rule that impacts hospital outpatient, ambulatory surgical center, and rural emergency hospitals quality reporting programs. Let's get started. CMS is finalizing changes and responding to requests for comment for the hospital outpatient quality reporting, ambulatory surgical center quality reporting, and rural emergency hospital quality reporting programs to further meaningful measurement and reporting for quality of care in the outpatient setting. First, we will talk about Hospital Outpatient Quality Reporting or OQR program. The Hospital OQR or Outpatient Quality Reporting Program is a pay-for-reporting quality program for the hospital outpatient department setting. The Hospital OQR program requires hospitals to meet program requirements or receive a reduction of 2.0 percentage points in their annual payment update. In the calendar year 2023 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule, CMS is finalizing a policy of maintaining voluntary reporting of the cataracts improvement in patients' visual function within 90 days following cataract surgery, which is OP31 measure due to the ongoing COVID-19 public health emergency. Interested parties have indicated that they are still recovering from the COVID-19 public health emergency and that the requirement to report OP31 measure would be burdensome due to national staffing and medical supply shortages coupled with unprecedented changes in patient case volume. CMS is also finalizing the alignment of hospital outpatient quality reporting program patient encounter quarters for chart abstracted measures to the calendar year for annual payment update or APU determinations and the addition of adding a targeting criterion in the selection of hospitals for data validation for hospitals with fewer than 4 quarters of data subject to validation due to receiving an extraordinary circumstance exception or ECE for 1 or more quarters. CMS also sought comment on the future re-implementation of the hospital outpatient volume on selected outpatient surgical procedures, which is outpatient 26 measure, or the future adoption of another volume indicator as a quality measure. Next, we'll talk about Ambulatory Surgical Center Quality Reporting or ASC-QR program. The ASC-QR program is a pay-for-reporting quality program for the ambulatory surgical center setting. The ASC-QR program requires ambulatory surgical centers to meet program requirements or receive a reduction of 2.0 percentage points in their annual fee schedule update. Consistent with the proposal in the Hospital Outpatient Quality Reporting Program, CMS is finalizing a policy of maintaining voluntary reporting of the cataracts improvement in patients' visual function within 90 days following cataract surgery, which is Ambulatory Surgical Center 11 measure due to the ongoing COVID-19 public health emergency. Interested parties have indicated that they are still recovering from the COVID-19 public health emergency and the requirement to report ASC 11 measure would be burdensome due to national staffing and medical supply shortages coupled with unprecedented changes in patient case volumes. CMS also sought comment on measures and topics for future considerations, including re-implementation of the ambulatory surgical center volume on selected ASC surgical procedures, which is ASC 7 measure, or adoption of another volume indicator as a quality measure, a specialty center approach for ASC quality measures, and interoperability and EHR use in the ambulatory surgical center quality reporting program. Rural Emergency Hospital Quality Reporting or REH-QR program. Section 1861 KKK 7 of the Social Security Act, as added by Section 125A1B of Division CC of the Consolidated Appropriations Act of 2021, requires the Secretary to establish quality measurement reporting requirements for rural emergency hospitals. CMS is finalizing that in order for rural emergency hospitals to participate in the REH program, they must have an account with the Hospital Quality Reporting System Secure Portal and a designated security official or SO. CMS also sought information on several potential measures for the new Rural Emergency Hospital Quality Reporting Program, as well as on topics of interest for the Rural Emergency Hospital Quality Reporting Program for future rulemaking, including rural emergency department services, rural behavioral and mental health, rural maternal health, rural telehealth services, and health equity. Overarching principles for measuring healthcare quality disparities across CMS quality programs. Significant and persistent inequities in healthcare outcomes exist in the United States. Belonging to a racial or ethnic minority group, being a member of a religious minority, living with a disability, being a member of lesbian, gay, bisexual, transgender, and queer community, living in a rural or other underserved area, or being near or below the poverty level is often associated with worse health outcomes. One approach under consideration for reducing inequity across their programs is the expansion of efforts to report quality measure results stratified by patient social risk factors and demographic variables. The request for information, or RFI, included in the fiscal year 2023 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Proposed Rule, which can be found in 87 Federal Register 2847, titled Overarching Principles for Measuring Healthcare Quality Disparities Across CMS Quality Programs, describe key considerations that they might take into account across all CMS quality programs, including the hospital outpatient quality reporting, ambulatory surgical center quality reporting, and rural emergency hospital quality reporting programs, when advancing the use of measure stratification to address healthcare disparities and advance health equity across their programs. In the calendar year 2023 Outpatient Prospective Payment System / Ambulatory Surgical Center Proposed Rule, CMS asked that readers review the full request for information in the fiscal year 2023 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Proposed Rule for full details on these considerations. CMS and the nation's hospitals work collaboratively to publicly report hospital quality performance information on the Care Compare website and the provider data catalog. You can find their websites in the description box below too. The overarching goal of the overall hospital quality star rating or overall star rating is to improve the usability and interpretability of information posted on Care Compare, a website designed for consumers to use along with their healthcare provider to make decisions on where to receive care. CMS developed this methodology with the input of a broad array of stakeholders to summarize the results of many measures currently publicly reported. The overall star rating provides consumers with a simple overall rating generated by combining multiple dimensions of quality into a single summary score. CMS is finalizing a change to Part 412, Section 190, Paragraph C to use publicly available measure results on Hospital Compare or its successor websites from a quarter from within the previous 12 months instead of the previous year.
This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.